Okay. The doctor just told me it's an aneurysmal bone cyst, and that what they need to do is put in bone.
Curette it out and put in some bone graft.
Curette it out and put in some bone graft, and that there is a risk of foot drop.
The perineal nerve goes right next to it, so there's a risk of foot drop, which can be temporary or permanent, and also numbness in the perineal nerve distribution, which is the foot, the top of the foot, and the side of the leg. And also your toes move up and the foot moves out. That's what the perineal nerve does. So those things are at risk. The other risk is that the cyst will come back, and I've seen these before where you have to do the surgery like 2 or 3 times over a period of years because the cyst keeps coming back.
Okay, doctor, are there any I mean, he's broken his leg twice in as many months.
Yeah.
There's no alternative to this option. Really,
well, you don't have to do it. It's not required. It's just I'd recommend it because it keeps breaking, and I think.
Yeah, I don't want that happening again.
Right. It's just going to be. I think it would be good for him to sort of have the bone be stronger. Which is,
okay.
If we get rid of the cyst, then it won't have that weakness there.
Yeah, okay. It won't happen again.
What in your learned knowledge is the statistical risk of the foot drop?
Oh, I think it's probably for a temporary thing. It may be I'd say 5%, and permanent is probably like 1% or less.
Okay.
That would be very
There's
good.
other risks of surgery in addition to the perineal nerve injury and the recurrence of the cyst. Recurrence of the cyst can happen as much as 30 to 40% of the time. So that's probably your biggest risk. But there's other risks, including anesthetic risks, infection, bleeding. The same risk with any type of surgery.
Okay.
So.
Can you?
And then the risks of the allograft.